Imagine waking up one day, you open your eyes, and all you can see are tiny flickering dots covering your entire visual field. Just like looking through an old analog TV, but with no way to turn it off. You see it everywhere, in the light, in the dark, even with your eyes closed. And there is no cure. This is the reality of patients with visual snow syndrome. Good afternoon, everyone. My name is Oliwia Kamieniecka. I'm a medicine student at the Medical University of Warsaw, and today I want to take you on a journey to understand that puzzling disease. Visual snow syndrome is a neurological condition that is persistent, constant, and non-progressive. The main syndrome is visual snow, described as tiny flickering dots covering the entire visual field. It is more prevalent with patients with anxiety and depression, and it consists of visual and non-visual disturbances such as tinnitus or dizziness. Its prevalence is estimated to be around 3%, which makes it quite a significant number. But it's important to remember that this number is underestimated because patients do not seek attention from medical help. Onset is mostly reported in adolescence, and there is no sex prevalence. The core symptom, as mentioned, is visual snow, the persistent static in the entire visual field. And additional symptoms are after images, photophobia, nyctalopia, and palinopsia. And it can also be accompanied by tinnitus, dizziness, and migraine. Let's take a look on graphics prepared by one of our patients to help us understand that disease. That's the main syndrome, visual snow. As you can see, there are dynamic tiny dots covering the entire visual field, and patients describe it as continuous flickering static. Palinopsia. Images persist after the primary stimulus is gone. It is described as trailing objects. Photophobia. Increased sensitivity to bright light. And nyctalopia, an impaired night vision. Enhanced endoptic phenomena. Interestingly, it is caused by white blood cells flowing through capillaries in the retina. International Headache Society has presented diagnostic criteria for that syndrome. Firstly, patient has to present the visual snow for at least 3 months. Then it has to be accompanied by at least 2 of 4 previously mentioned visual symptoms. Then symptoms are not consistent with migraine with aura, and symptoms are not better accounted by another disease. There are a few proposed mechanisms of pathophysiology. It is likely caused by abnormal sensory processing, and current hypothesis involves multiple overlapping mechanisms. Hyperexcitability in the visual cortex may lead to continuous perception of visual static. Thus, that hyperactivity may cause a constant background noise in the visual perception. Altered thalamocortical circuits lead to an exaggerated response to the stimulus, resulting in visual and auditory disturbances. An imbalance between neurotransmitters in sensory processing regions can contribute to excessive and persistent excitatory activity. Cortical spreading depression is a phenomenon when the polarization of neurons spread across the cortex. This phenomena persists, leading to constant visual disturbances. And even a psychological aspect is taken into consideration when talking about the cause of visual snow syndrome. Daily routine tests usually do not reveal any abnormalities, but are helpful to rule out other possible diagnoses. Functional MRI presents increased activity in the primary and secondary visual cortex, as well as in lingual gyrus, suggesting that the visual pathway may be overly active. Positron emission tomography demonstrates increased glucose metabolism in the lingual gyrus and fusiform gyrus. Those regions are associated with sensory processing. In EEG, we can observe reduction of alpha wave activity over parietal and temporal regions, suggesting dysregulated cortical rhythms. Magnetic resonance spectroscopy reveals increased lactate and glutamate levels in the right lingual gyrus. Those substances are indicator of increased metabolism, suggesting that there are dysregulated cortical rhythms. Results of visually evoked potentials present subtle abnormalities, such as delayed P100 wave. This might indicate a minor dysfunction in the visual pathway. Here's a comparison of two tests performed on the same patient within 1 year interval. As we can see, no significant changes have been observed, which suggest the hypothesis that this disorder is not progressive. Visual snow syndrome is often misdiagnosed. The most common differential diagnosis is migraine with aura, giving it frequent co-occurrence. It is estimated that around 60% of patients with visual snow syndrome have a history of migraine. What is more, those two disorders can exacerbate each other. Clinicians should also exclude retinal disorders and neurological conditions such as occipital lobe epilepsy and optic neuritis. Whenever rapid onset of symptoms is reported, it is important to rule out ischemia of optic nerve or Leber optic neuropathy. Those patients struggle with daily tasks, such as driving in the dark or using a screen. That syndrome has also an impact on their mental health. Almost 50% of patients struggle with anxiety, and over 50% of them are diagnosed with depression. There are many factors impacting the severity of symptoms. Bright or low light conditions, fatigue, or lack of sleep can exacerbate them. When accepting the disease, lowering the exposure to stress, or adjusting lifestyle may help patients. There is no treatment scheme, and for now, it is about managing the symptoms. There are limited evidence for effectiveness of medications such as lamotrigine or topiramate. The most studied drug is lamotrigine, with estimated effectiveness of 22%. Cognitive behavioral therapy, while not directly targeting the symptoms, it helps patients with coping with that disease. Additionally, non-pharmacological interventions might benefit the patients. For example, tinted lenses for screen use and sunglasses during the sunny weather. Repetitive transcranial magnetic stimulation has shown effectiveness in recently published research, but it's still being studied. To sum up, visual snow syndrome is a neurological condition that consists of visual and non-visual symptoms. It is often misdiagnosed and under-recognized, and there is much need for further research. And finding the effective treatments. Visual snow syndrome may blur the patient's vision, but our understanding of it must remain crystal clear. Here are the references I have used to prepare my presentation, if anybody is interested in this topic. Thank you.